Hey, Dr. C here. Hope you're having a good day. What we're going to talk about today, I did present a little bit about a year ago on wellness. Now, the elderly don't usually relate to the wellness movement, you might say, because it is a thing of the last generation, and now it's getting a little bigger now with the present generation. So the whole wellness thing that I presented back then, I minimized a lot of the stuff related to medicine. So the focus today is not just on the wellness aspect, but also the medical wellness aspect, and very specifically, age-friendly health systems. Now, there's a lot of people who don't even, and have never heard that concept before. So that's why I'm presenting this. So first of all, let me start out once again with the whole wellness concept. Okay. So first of all, I always start out with a definition. What the heck is wellness? What is it? Well, supposedly, it's a state of well-being where an individual realizes their own abilities, their own disabilities, and they can usually cope with normal everyday stresses that can come up. That is an important concept because, as you know, there are stresses every day that come into your life. And some of the elderly have difficulty coping and getting by some of those stresses. Now, a lot of people also put into the definition of it that the individual should be able to work productively. That's wonderful if you're younger, you know. And they should make a contribution to society. Oh, that's the latest thing, contribution to society. But at any rate, obviously, the definition of wellness is still in flux. This is what the bottom line is. Also, the Global Wellness Institute, global, that's a big institute, right? They define it as the active pursuit of activities that would lead to a good state of health. Now, again, that needs to be broken down into many different ways. That is more for the wellness concept that has gotten into employment, into the large employers, because the wellness concept was bought into by a lot of the larger corporations. They saw a possibility here of getting a more productive working staff and a happier working staff, a staff that would stay with you rather than go job to job to job. And apparently it does work in many instances. So, like I said, it's a concept that is not necessarily one for the elderly in general. There are many different aspects to wellness. In fact, they've defined 9 different areas of wellness that fit into that picture, basically. Number 1, and might as well quickly go through them anyway. Number 1, intellectually. The intellectual wellness. What do you have to do to be intellectually well? You need to have good study habits. You need to learn to manage your time as well. As we age too, we see both sides of every argument. We don't just jump in conclusion to the first person who talks about it. You say, well, there's always another side. Tell me about that as well. So that all fits, basically, with the intellectual part of wellness. Now, there's also an academic part and a personal part to that intellectual strength. The academic part is the creative part, the very creative part. Very good in problem solving, in other words. So and also some degree of flexibility. So that is the academic part. There's also, however, the personal part. The personal part is self-discipline, patience, being respectful. All these things are part of personal intellectual development. Now, what about social wellness? Well, you need to be assertive to a degree, socially. Not too passive, not too aggressive. In other words, like the Goldilocks, just right in between the two. So you need to be assertive to a point. You need to balance out your social calendar, your personal time, and your family time. Now that was damn difficult as a doctor on many different call schedules. We put patient first. Ourselves we put last. Patient was always first, then family. Now the doctors are putting family first, they're second, patient third, unfortunately. So socially, that's basically what you're looking for with social wellness. There's also a spiritual wellness where you connect. Now, it doesn't necessarily have to be connection to a church. It doesn't have to be to a religion. It could be connection to meditation. In other words, you don't necessarily have to have an organized religious or spiritual place. You can use self-meditation. So that is part of spiritual wellness. Occupational wellness, what is that? Well, you want to make whatever you're doing interesting. That's what you should do in your younger years when you choose your profession. You have to have fun. You have to be able to be happy. You have to be able to feel like you're wanted, you're needed. You need that. That's all part of making your work interesting and motivated. Now, obviously, that has a lot to do, well, actually more to do with the younger people than it is with the elderly. But we still have that balance. We still have that balance. We always do. Okay, that is occupational wellness. What else is there? There's financial wellness. And that is a big deal, especially in light of the horrible time in 2008, in terms now of the inflation on top of it. Who's to blame for all that? I blame politics. But that's my interpretation of it. But the financial wellness, you need to have sometimes, you need to have some assistance. And if you do, where do you go? You need support. You may need some counseling. Watch out, however, where you get your counseling. Some people will take a weekend seminar and now they're financial counselors. Beware of that. Make sure you get good advice for your finances. There's enough problem with scams than also with people who don't have the wherewithal to help you with your own finances. Also, we then get into the mental aspect, mental wellness. Now that is a big deal, and we get the least amount of help usually with the mental wellness. Not that many people who can help you with that. Basic issue is you have to know yourself. You have to admit if you have depression. You have to admit that you have anxiety. It's not that difficult to perceive. You can tell if somebody is anxious. You can tell when somebody is depressed. You can tell when they have a problem. They know they have a problem, but may not admit it. So you have to know yourself, number one. Okay, well, let's then talk about the main thing we're going to talk about today, which is the medical wellness. Now, medical wellness usually relates to your physical health, your physical well-being. A lot of people out there in different aspects of the health field. A lot of people who are telling you how to exercise. A lot of people who are telling you how to care for your body, all the lotions and potions. Use this for pain, use that for pain. A lot of nutritionists telling you what to eat. A lot of people involved with so-called medical wellness. But how many of them are actually helping? And almost all of them cost. They cost money. So what do we do for medical wellness? Well, some are very obvious. For God's sakes, don't smoke. Number two, don't drink more than 2 drinks a day. You know, simple things. I wouldn't even advise a younger person to get into the marijuana. Yes, CBD does help. And yes, some of the CBD that they have nowadays is very pure. But you'd have to know what to do. You have to know the exact one to use. And not just buy the first thing that you see on the market. That's all part of medical wellness. Control your weight. Also, you need to know paramedical services, which are good for you and which aren't. Your fitness. That's why I have exercise classes. You can do your own fitness. You don't have to go out. You can do your own right at home. And I had a show on all of the simple, very inexpensive things that you can use at home. So that's all part of medical wellness. More recently, we have come into what is called age-friendly health systems. Now, when I first heard that term, I hadn't heard of it before. A lot of people in this area have not heard of it. Age-friendly. But boy, is that needed. I remember that it wasn't that long ago, in fact, just a year ago, where they passed Laura's Law. Laura's Law. Laura was a younger person who had a severe asthmatic attack. She wanted to go to the she knew she had to go to the emergency room. You've seen now what has happened with a lot of these medical centers now. They are massive. There's signage all over the place. Not well lit. So if you had to go to an emergency room, a lot of them had difficulty, especially the seniors, had difficulty negotiating getting to the emergency room. And once they arrived at what looked like the entrance and all, there was no one there to help them, show them where to go. So they passed a law, Laura's Law, because Laura lost her life because she had first a difficult asthmatic attack, and on top of that got a delirium, in other words, very confused, trying to find her way into an emergency room for assistance. So that started then the age-friendly health system, where you would get help not only just with the emergency room itself, but also generally. Medicine is not friendly to the elderly right now. There are very few gerontologists, people, the doctors who take care exclusively of seniors. That's one of the least of all of the subspecialties now of medicine. Not as many people going into it. Why? Because it isn't as rewarding as actually doing procedures so you get paid better. So that is an unfortunate thing. So what is this age-friendly health system? What is it supposed to, what's its purpose? What is the purpose of it? Well, what it does is it tries to connect various professions in medicine, various sectors that will join together, make a union to help a particular patient. The goal is to improve access to the services. The goal also is to address all of the inequalities that are presently in the system. And it also will deal with end-of-life issues. As a result of this, there was a study that was done, and the study showed that all of the problems, the inequities, etc., went into 4 separate categories. Number 1, medications. Okay? We realize that medications are an issue for the elderly. And we know that medicine is very fragmented, and that your primary care doctor, or whoever the primary care health care deliverer is, may not necessarily know about the medicines or changes in the medicine given by a specialist. Very, very fragmented. Doctors also are moving or retiring or getting burned out. I know we had 4 different primary doctors for my wife in the course of 2 years. 2 years, 4 different. That is fragmented healthcare. So that is part of the medications. Do the people know about all the drug interactions? Do the people know if the drugs that they're taking prescribed are appropriate? They may have been appropriate when they were first given, but now that you've been on them for a year, 2 years, 3 years, are they still appropriate? Are they being reviewed every time you go for a physical exam? All I know is that you have to have that list. They go over that list. Nobody reviews that list for appropriateness. Nobody reviews them to deprescribe, to take away a medication that may not necessarily be needed. Also, there are interactions between the medications. There are interactions between prescribed medicines and over-the-counter medication that you can get. Who's reviewing that? Does your doctor review that when you go for your annual physical examination? Probably not. Probably not. They may not even know all of the medications that you just buy over the counter. I've seen people who have bag loads of different over-the-counter medications that they're taking because of the marketing, tremendous marketing skills that these pharmaceutical houses have. And a lot of people fall prey to that. We got to have this, we got to have that. You don't need a prescription for it. Must be good. Oh, let me tell you. So the medications, that results in a thing called polypharmacy, a big deal. Now there is a thing that's out there which is supposedly, if it's used properly, supposedly will review the senior's medication for appropriateness. It's called the Beers criteria, Dr. Beers. And it will, using their criteria, go through all the medications and all the interactions that can occur with other meds or with over-the-counter meds. And it'll tell you if something is not appropriate for your age. Do all the doctors use it? They know about it, but do they take the time to use it? Probably not. Probably not. Okay, so what other thing besides medications? Mentation, mental health. Mental health. We've seen a lot of delirium, massive confusion as a result of our mega medical centers. We also see dementia in various stages as well. A lot of people still like to stay at home. The dementia is not bad, and they can function at home. Nobody takes the time to go over that with you. So that is another issue, the mentation issue. Then there's the mobility issue, the safety. How is your gait? Do you have excellent balance like you did when you were younger? Can you perform all of the activities of daily living? Now, social workers have a list of all the activities of daily living that you're supposed to be able to do yourself. Mobility, number one, can you move around, walk? Dressing, do you dress yourself? Do you select the right clothes for the right reason? Number three, personal hygiene. Do you bathe? Do you groom? Do you even brush your teeth on a regular basis? Toileting, number four. Can you control your bladder? Can you control your bowels? Can you clean yourself after you perform? Number five, eating. Can you feed yourself? More so, can you prepare it properly and then feed yourself? And then transfer. Can you easily get up from a chair? Can you get up off the floor? Gets a heck of a lot tougher the older you get. So all those are activities of daily living. And a lot of the nursing homes now call themselves assisted living facility because they have to support one of those activities of daily living that a patient cannot do anymore. But there's also more to it than that. They also call instrumental activities of daily living. Preparing your food, managing your medications, taking them at the right time. Shopping, can you go out shopping at all? Can you communicate well with others? Can you manage your finances? That's a big deal. Managing your finances, avoiding scams. Housekeeping. Can you keep a clean house anymore? Or are you now focusing on one room only? Can you get around? Transportation. That is a big deal. Not driving anymore is a very big deal. And so, the last one for instrumental is being able to do your laundry, washing things on a daily basis. And I also put in there, with the food preparation, washing your dishes properly as well. So those are all the activities of daily living that the assisted living facilities are making boodles of money on right now. So, at any rate, what are the other issues now that we had one more M. We had one more M. My God, I didn't mean to. Oh my God, I lost the other M. Well, whatever. We got, oh yes. Okay. All of the other things that are important matters. The matters. And with the matters and all, you need to know who your primary care doctor is, who your other secondary doctors are. You need to know and you need to communicate problems to your primary care health deliverer. That is one issue that we see very, very often. They don't talk to their doctor. They don't tell them the day-by-day things. On the other hand, the doctor doesn't have that much time anymore to talk to the patient. They come in, they don't even look at you. They get your vital signs. They go over your medicines. They listen to the heart and lungs. Can we renew a prescription for you? On your way. Oh my God. But that's the way it is. So that is a matter. That is a big matter, actually. So the final thing, too, is the actual wellness visit. Now, why do I mention the wellness visit? Medicare covers an annual wellness visit. Now, that wellness visit is totally different from an annual physical examination. You don't get a full physical examination with a wellness visit. But what you do get are more preventative things. With the physical exam, they're looking for signs of an injury, signs of a disease, and if they find it, they treat it. That is the traditional medicine. With wellness, we want to try to prevent all these things in the future. So there will be a number of things looking at, for example, safety. You don't want to have an injury, a fracture, or whatever. And so all these things, the safety aspect of it is there. So that is a full wellness visit. And then they will give you instructions on what to do to preserve your wellness. Now, there are issues. Number one, ageism. And boy, ageism is out there. I don't care what they say. It's out there. People, especially the doctors, may be less tolerant as we get older. They are not as respectful as they used to be. They rapidly dismiss our concerns. Now, our concerns may not be major in their eye, but they are to us. So that is one of the issues. We're all lumped together. You're over 65. You're Medicare now. You're different. Yeah, we are different. So that is an issue. That is the ageism issue. We may see a lot of prejudicial behavior out there. And you may get it especially from government, federal, state, local as well. So there is a lot of prejudicial behavior out there. We may also see it if you don't have all your eggs in the basket ready. Now, what do I mean by all the eggs ready for the end of life, basically? There are things you need early on, like a will, like a revocable living trust, like a power of attorney, and also a health proxy. Those 4 things you need early. Later on, you need to have your advance directive very clearly stated. Later on, that's when the MOLST form comes in. That is basically a DNR form. I have always advocated that you should all have a MOLST form filled out, but not signed. Not signed until you know exactly what's going to happen. Like you're given a month to live or something. Now you sign that sucker. So we'll have a whole session on all these different aging problems later. Okay, this is Dr. C. We covered a lot of stuff. Have a good day.